Hello, my name is Jimena Chavez. My topic is Cystine, Crystal, and Bone Marrow. I study in Catholic University. Cystonics is a condition of widespread its beloved crystal in different organs. Of the body, such as the kidney, eye muscle, pancreas, and vein. It is caused by mutation in the CTNS gene. It affects about 500 people, mostly children, in the United States and about 2,000 worldwide. Cystine is inherited in autosomal recessive pattern with mean and child with the disease to parents who are carriers, and the child has two recessive. Here there is a 25% chance of one of four of spring having fought.
We continue our 7-week health campaign, this week focusing on bone marrow awareness and the importance of donating. Imagine hearing that your child has a life-threatening illness, and then you're told there's only one person out of 14 million who can save her. Tonight, we introduce you to a Sarasota girl who has stared down death and defied the odds thanks to one perfect match.
This one was a camera.
Like many elementary school children, Hannah Marsh has a large family album full of photos and drawings.
She colored it for him, but he left it for her.
But the bright, playful colors are deceiving, camouflaging dark days when death hovered nearby.
That was the night before we started everything.
Started a fight for life that began with something so simple.
She woke up one morning with a nosebleed, something very simple, kind of a common thing, that a lot of kids have. And went to wipe the blood away, and there were spots all over her skin, and they were under her skin.
Rushed to the hospital, test showed Hannah's platelet count so low it was life-threatening.
The nosebleed lasted for 4 hours. We had nurses coming in around the clock. I couldn't hold my hand up that long. At that point, they were giving her infusions left and right, platelets, blood.
Finally, a diagnosis, a difficult name for a deadly disease.
It's basically your immune system fighting from the inside out. And it attacks almost every organ, all your blood counts, all your blood cells, liver, spleen, brain, everything.
And the news kept getting worse.
It's a fatal disease. The only cure is a bone marrow transplant.
25% of the time, a match can be found in the family. Not so in Hannah's case.
We had no choice, but we went. The National Marrow Donor Program would be the match. Ended up doing the search for us. There was no match for her in the United States.
They ended up going to the international registry where they found one match out of 14 million registered participants.
It's a 50-50 chance that you even get to transplant if you're actually diagnosed properly.
Flown to Cincinnati Children's Hospital, which specializes in treating HLH, chemotherapy, steroids, and blood transfusions kept her alive until the bag of donor cells finally arrived from overseas. The bone marrow transplant took place. Isolation followed.
My mom just said, try to stick through it. Don't give up.
Mom and daughter documented their journey on YouTube, and slowly Hannah healed, re-entering life a success story among so many sad failures.
They call it the silent killer. This disease, HLH, is known as the silent killer because usually it's diagnosed post-mortem.
Thankful for this second chance, the Marsh family began spreading the word about HLH and the importance of the bone marrow registry. But something seemed unfinished.
Excited.
Now, since I'm here, I kind of get the emotional feeling of where you just lay on a bed, you spread your arms out, they put a needle in here, needle in there, and then they filter it out. And it's only about 4.5 hours. And, well, It's a bit uncomfortable, but that's it. Then the bag goes.
Others the way that her doctors helped her. Now, if we've inspired you and you'd like to help, join us Sunday, April 1st at Al Lopez Park, located on Himes Avenue in Tampa, for the first Be the Match, Be the One run here in our state. ABC Action News will have a team walking and running.
Genotypes of having and not having cystosin. Alleles are normal hen, are cystine hen. The genotype of an individual with cystinosis has to hen with the mutation. Phenotype of individual with cystinosis. When the cystine amino acid head in tall cells but have no transporter, they can get out. Therefore, they cause real cell death. Different types of cystinosis. Nephropathic cystinosis, intermediate cystinosis, and non-nephropathic or ocular cystinosis.
Cystinosis, a genetic disease characterized by the widespread deposition of the amino acid cystine in cells due to a defect in cystine transport. Cystine normally forms after protein degradation and is transported from structures called lysosomes into the cytoplasm. In cystinosis, cystine accumulates in the lysosomes and eventually forms crystals throughout the body. Cystinosis is therefore a lysosomal storage disease. The disease is inherited in an autosomal recessive manner. The gene that is mutated in the disease is symbolized CDN and has been mapped to chromosome 17 to region 17p13.1. It encodes the protein cystinosin, which transports cystine. The initial symptoms of cystinosis are renal and appear between 6 and 12 months of age. The accumulation of cystine results in what is called the renal Fanconi syndrome, the failure of the tubules in the kidney to reabsorb small molecules, causing increased urinary loss of electrolytes sodium, potassium, bicarbonate minerals, glucose, amino acids, and water. These losses results in biliruria, excessive urination, polydipsia, excessive intake of fluid, dehydration from the excess urination, hypophosphatemia, rickets due to loss of phosphate in the urine, and growth retardation due to the renal disease. Photophobia, excess sensitivity of the eye to light, occurs between mid-childhood and adolescence due to accumulation of cystine crystals in the cornea. Cystine storage in the thyroid leads to hypothyroidism, usually around age 10. Intelligence remains normal. Treatment of the renal Fanconi syndrome is by replacing the renal losses and supplementing with citrate to alkalinize the blood. Phosphate replacement prevents and heals the rickets. Vitamin D helps the intestinal absorption of phosphate. The outlook with this disease changed for the better with cystine depletion therapy using cysteamine cystatin, which depletes cystine.
Infants with nephropathic cystinosis usually should grow, and renal kidney disease which causes the kidney to not aid in salts, fluids, and essential nutrients. This loss of nutrients results in bowel and increase in urination, deaths, deshydratation, and acidic blood.
Cystine kidney stones, one of the hardest formations of kidney stones, occur most often in children and young adults with a rare hereditary disorder known as cystinuria. While no cure exists, people with cystinuria usually develop cystine stones throughout their lifetimes, unless they take preventative medications or receive kidney transplants. Less than 1% of kidney stones in adults and 6 to 8% in children are made of cystine, a crystalline sulfur-containing amino acid. What causes cystine kidney stones? While healthy kidneys absorb cystine from the urine and transfers it to the blood for reabsorption, the kidneys of people with cystinuria do not reabsorb cystine properly and cause a buildup of the amino acid in the urine. Eventually, this buildup of cystine crystallize and form cystine kidney stones. Researchers believe genetic mutations cause cystinuria. What are the symptoms? Like most kidney stone formations, cystine stones may cause no pain or severe pain that often begins on one side of the back and gradually moves down to the groin area. Other possible symptoms include nausea and vomiting, blood in the urine, frequent need to urinate, burning sensations when urinating, and fever and chills. One unique symptom of cystine stones compared to other kidney stone formations is some people report a continuation of the same pain after removal of their stone. How does a doctor make the diagnosis? After a urinalysis, doctors can suspect cystine stones if the urine is acidic and they find a high level of cystine crystals, which are transparent and hexagonal in shape. Also, to detect elevated cystine levels, doctors can add sodium nitroprusside to the urine to observe if a purple-red color appears. Most kidney stones found in children are due to cystine stones. What are the treatments for cystine stones?
Treatment. Every infected patient is individually according to their condition. Treatment requires free access to water and oral replacement of salt and mineral lost in urines. A lot of vitamin D and phosphate are needed to replace los nutrients and minerals and also replace rickets.
3.
Thank you.